This video, titled Immediate Effective Treatment for Soft Tissues, is an excerpt of a presentation which was done at the Meiji University of Integrative Medicine in 2006 in the Inter-Japan Congress of Judo Therapy. Soft tissue injuries, such as pulled muscles or neck pain acquired from sleeping, are clinically common. However, there is no proper treatment to cure them completely. In this presentation, I compare the conventional methods of treating soft tissue injuries to a newly invented treatment, namely the FDM approach, and thus demonstrate its effectiveness. Firstly, I will define the anatomical meaning of a pulled muscle, which is an injury we often treat. A pulled muscle occurs when there is a partial tear of muscle fibers, and the amount of the torn fibers is less than a ruptured muscle. This is the definition of a pulled muscle. Moreover, regular sprains, as well as neck pain acquired through sleep, are only stretched muscle, tendons, or ligaments. In the treatment of such injuries, conservative methods of treatment only protect the injured area, and the only thing patients do is just wait for the healing process to naturally occur slowly. RICE, rest, icing, compression, elevation, has been misunderstood as the absolute treatment, although it is actually a temporary solution, and no other treatments are performed. It's natural that there is no progress. Moreover, there is no hope in the future. If revolutionary treatment is to be considered, then the very definition of each injury must be reconceptualized. According to FDM, which is a revolutionary treatment, soft tissue injuries are the result of a facial distortion. Fascia is a muscle tendon, ligament and bone, and so on. It is what we generally call tissues, which our body is composed of. In soft tissue injuries, such as pulled muscles, these fascia are altered by external forces. And these alterations are possible to be reversed by manual therapy. In other words, alterations caused by the external forces can be reversed by the forces of manual therapy. Therefore, this revolutionary treatment for these injuries is an active treatment which works on the injured area directly. And the anticipated results are immediate, healing and recovering the physical function. Let's now see how this works in these clinical video clips. This clip shows a patient who has pulled muscles in his thigh during his volleyball practice. He was diagnosed by an orthopedist with pulled muscles, and it would take 3 weeks to heal. He was put in a cast and given crutches and cold packs, and was advised to rest and not exercise. However, by manually treating the soft tissues directly, the injured fascia was restored to their original condition. After the first treatment session, he was able to exercise and took part in a scheduled sport competition. Like these, it's possible for injuries of soft tissues to be restored as they were. Because there are specific characteristics of fascia, although it is not understood well by conventional therapeutic practitioners. For example, it is important to note that injured soft tissues can be reattached immediately to their original state. Even if there are small ruptures, Through proper diagnosis and treatment, this can be done. This happens only when proper manual treatment is performed. Let's see the other clinical clips. This patient injured his shoulder when he caught a ball in an unusual posture during his baseball practice. The next day, he went to an FDM clinic for treatment. His shoulder range of motion was severely restricted, and he was not able to do daily activities. However, after FDM treatment, the damaged soft tissues were cured, the symptoms were alleviated, and the normal functions of his shoulder were restored. Let's look at the next clips. This woman got into a car accident 2 days before visiting an FDM clinic. She was diagnosed by an orthopedist with having whiplash. Her cervical and shoulder function was considerably restricted, and she had severe symptoms. But in this case too, immediately after FDM treatment, the damaged tissues were cured, the symptoms were alleviated, and the functions of her shoulder and cervical were restored. These obvious clinical results change the definition of soft tissue injuries, such as pulled muscles. The fact is that substantial alterations exist in injuries. This fact has been overlooked by the medical field. Without substantial alterations, there can be no symptoms. And thus, when there are no symptoms, obviously this is called a normal, healthy condition. Therefore, the practical treatment is restoring the alteration. This is why conventional methods such as the conservation of the symptomatic area cannot be called treatment. The proper way to restore the substantial alteration is called fascial distortion model. Moreover, we'll see some clinical clips which demonstrate the effectiveness of FDM. First of all, this woman had phonation difficulty for 4 days due to catching a cold, or as a result of a simple illness. In the past, she had the same experience for a long time. A doctor said it was phanerogenic. However, she completely recovered after one FDM treatment session, which cured the soft tissues around her throat. Next, this man had a foot injury when he hit his toes against the curb while riding his motorcycle. An orthopedist diagnosed him with having a sprained ankle and advised him to stay still for 3 weeks, giving him a cast and cold packs. In the same fashion, an FDM practitioner alleviated all of the symptoms in one treatment session. Therefore, a second treatment session was unnecessary. Finally, this man had acute lower back pain and couldn't stand before visiting an FDM clinic. Although he didn't go to see an orthopedist, almost all of his symptoms were alleviated by one FDM treatment session. As these clinical clips demonstrate the effectiveness of FDM treatment for musculoskeletal injuries, in this field FDM has been making excellent progress compared to conventional treatment. FDM treatment is very simple, as it only requires recognizing the altered tissues, palpating them, and then reversing them. This is what we call the facial distortion model.